Here's the problem. According to the Agency for Healthcare Research, low deductibles and small co-pays can increase the cost of your health insurance by as much as 40%. Because minimal co-payments make it easy for us to submit insurance claims for minor healthcare expenses that we can afford to pay without insurance. Of course, we all need insurance to cover major healthcare expenses like surgery or hospitalization. But expecting our health insurance to pay for minor medical expenses like checkups, flu shots, and teeth cleaning is like expecting our auto insurance to pay for routine maintenance like oil changes, tune-ups, tires, or brakes, or expecting our homeowner's insurance to pay for household repairs like plumbing, electrical, roofing, or painting. Of course, we need to pay for those expenses, but we don't need insurance to pay for them. So, what's the solution? A tax-exempt health savings account and low-cost major medical insurance. It's a combination that can reduce the cost of your insurance by as much as 40%, minimize your rate increases, allow you to choose your own health care benefits, and pay for all your health care expenses with tax-deductible dollars. Here's how it works. A health savings account, or HSA, is like an individual retirement account, an IRA. But for health care expenses, instead of retirement income, the money you deposit is tax-deductible, and the interest you earn is tax-exempt. But the money you take out to pay for health care is also tax-exempt. And whatever you don't spend, you can later use to pay for future health care expenses, which gives you control over your health care benefits, not the insurance company. You can deposit up to $3,000 a year into a personal HSA, or more than $6,000 a year into a family HSA. And you can transfer money from your IRA or 401k account to set up your HSA. Of course, the money you save on the cost of insurance should be deposited into your HSA every month. But you can also transfer money from any other savings account whenever you want. You can write checks on your HSA, or use an HSA debit card to pay for your minor health care expenses, and you can spend your tax-free HSA money almost any way you want, including products or services that might not be covered by your health insurance, like chiropractic, acupuncture, or homeopathy, as well as dental and orthodontics, hearing and vision care. However, you cannot use your health savings account to pay for medically unnecessary or cosmetic procedures, like teeth whitening, facelifts, or hair replacement. Of course, you can also use your HSA money to pay for major medical expenses as well. For example, if you were to choose a $2,000 deductible with a 20% copay on the first $10,000, and you are diagnosed with a serious illness like cancer, or you are brought into a hospital emergency room with a serious injury from an auto accident, you would pay both the deductible and the copay from your HSA, and your major medical coverage would pay the difference. So, even if all your medical expenses amounted to $100,000, you would pay only $4,000 with tax-exempt money out of your HSA, and the insurance company would pay the rest. That's why the U.S. Treasury Department estimates that more than 10 million Americans have already set up HSAs, and as many as 50 million more will be covered by health savings accounts and major medical insurance within the next 2 or 3 years, either on their own or through their employers. So ask yourself this: does it make sense to pay for insurance to cover minor healthcare expenses as well as major healthcare expenses when it adds as much as 40% to the cost of your coverage? Or does it make better sense to pay for your minor health care expenses from a tax-free savings account and let the insurance company pay only for your major health care expenses, especially if it will reduce the cost of your insurance and let you keep whatever you don't spend to supplement your Medicare coverage during your retirement?